Oh yeah, no. Okay, I heard that. So welcome, sorry, it's ready already. So welcome everybody. Lovely to see you all and lovely to see you all online as well. So it's my great pleasure today to introduce two speakers. We've got Rosa Cheesman and Joakim Ebeltoft, who are from the parental research group at the University of Oslo. So this is a group that looks at mental health from various different perspectives, bringing in genetics, social inequality, local communities, policy, and they're going to tell us all about the research that they're doing today. And I should also mention that they're visiting us for a whole month as well. So if you don't get a chance to speak to them after today's lecture, then do go and see them in OS2B1. Yeah, just around the corner. And I'm sure they're up for meeting lots of us while they're here as well to discuss research. I'll pass over to Rosa, who's going to be giving our first presentation on the interplay between genetic differences and school inequality. So over to you, Rosa.
Thank you. Thanks for coming, everybody. I'm very excited to be here. And yeah, because I'm going to be here for a whole month, I wanted to give a very general talk about various things I've been interested in and kind of themes that I want to continue researching, with the aim to be perhaps to find common ground with you guys and yeah, trigger some discussions. So I've got a bit more of a general talk on what genetics can tell us about educational inequalities. And I've been really fascinated by how all this new big genomic data on socioeconomic outcomes can actually really help us with social scientific questions. And yeah, there are three key kind of tangents of the work I've been doing so far. So one is using genetics to understand family environment, kind of more traditional social background effects and how those work. Secondly, school inequalities. And then thirdly, horizontal social stratification, which is this concept of, how people don't only differ in how long they're in education, but what they're actually doing and how does that impact their later life health and fertility and everything. So I'm going to go quickly through the family one because I don't think I need to explain any of that stuff to this audience. When we look at these genetic associations with outcomes like educational achievement and attainment, we're not just capturing so-called direct genetic effects, which are going through kind of the individual's personality, cognitive and non-cognitive skills, but also because of gene environment correlations, we're capturing indirect genetic effects of parents. And the work I've been doing previously has used genetics to try and understand the causal effect of parents on children's outcomes, like education and depression, using the parent's genome as a kind of proxy for a wide range of mechanisms. So I wrote a review not long ago that kind of summarizes multiple studies and kind of the different ways of using family data to disentangle these social processes. So one is, integrating family data, for example, in trios or siblings. I did a study using genetic data on adoptees to try to disentangle parental effects from direct genetic effects. You can also triangulate different within family study designs like sibling trios and adoption. And that because those methods have different capture biases in different ways, then you can identify how important different biases are. And then there's also this useful knowledge that we have from developmental behavioral genetics studies that I feel could be applied more in this genomic era. For example, our knowledge about how genes drive stability in depressive symptoms over time. So if we can capture more stable, lifelong symptoms, that gives us more genetic signal. So yeah, that's the family side of it. And then secondly, I've been really interested more recently in school inequalities, and this is this picture is referring to this Coleman report from the 60s, where which has been really influential, where this author was saying a key kind of aim of schools and school policies should be to reduce inequalities of birth. And so there's been tons of research in sociology, economics, etc., on the extent that schools can compensate for early life disadvantages. So we've been really interested in applying that kind of way of thinking about it to genetics. Can schools kind of even out disparities between children in their educational performance and educational opportunities that are due to genetic differences that they can't control? So the Norwegian data is really useful for looking at this kind of thing, because we have MOBO, which includes parent-child trios. So we have genotype data on trios, and we can look at this within family genetic variation, and that allows us to control for selection into schools, which is a major problem in all of these kind of studies. When you look at the children's within family polygenic indices, for example, that's really a random subset of their parents' genetics, and we therefore kind of get rid of parental selection into the schools. And then in this Norwegian data, we also know basically where every child went to school. We have the school IDs, so we can group the kids up into schools. And in MOBA, we have data on on every participant's school, and we have about 11 or 12 children per school on average. So what I did to look at this question of whether schools compensate for genetic differences was just a multi-level model looking at the effect of educational attainment, PGI, on national test performance, and then you effectively get a different slope for the effect in every school. So then you can see here that in the red schools, those are the schools where the slopes are weakest, and in those schools, the performance overall is higher. In comparison to these schools where the slopes are the strongest, so genetics makes a bigger difference. In those schools, on average, like the achievement is lower. So basically, the schools that are doing better overall, the intercept is higher. Those schools are also able to compensate for this kind of lower polygenic index for education. So this is the same data but plotted in a different way, which I think is a bit more oriented towards social sciences. So on the y-axis, we have the proportion of variance in national tests that's due to school differences. So that's across this population-wide data, what's the total amount of variation due to school? So this is Norway, where they have like massive efforts to make all the schools really similar to each other. So for the average child, we see that schools don't make very much of a difference. They're explaining only about 2% of the differences between kids in their achievement. But then as you go down this axis and start comparing kids who have lower polygenic indices for education, the role of school is greater. So this is basically a gene-environment interaction where the school inequalities are greater for kids who probably have more needs. And at the same time, it's also evidence that in a more positive framing, that schools can compensate for genetic disadvantages. So you can look at it glass half full, glass half empty. The Norwegian system, even though it's functioning well for the average child and eliminating school differences, for other children, it's actually there's actually some inequalities. Okay, and then some ideas about how to make use of this kind of approach. I think it could really play into current debates about how to make schools more equitable environments for different children. Like there's been this huge kind of crisis in trust in schools as kind of safe environments for children who bring in individual differences, for example, with autism or dyslexia. So with this kind of research strategy, we could actually expand our inclusion of different kinds of children in school inequality research and try to understand what's going on in these schools. How can they provide better environments for children with different patterns of kind of challenges and so on. Okay, and then more recently I've been looking at this concept of horizontal stratification. So in genomics, everyone's been really obsessed with how long have you been in education, and we've been kind of ignoring what are people actually studying. And within sociology, that's known to have a big impact on your labour market outcomes, who you even meet, who you reproduce with, how many children you have, your health, like your workplace kind of environment and so on. So yeah, we know that educational fields confer all these different kinds of skills like caring, technological skills, computing skills. It determines, the fields determine what skills and knowledge are available in the workforce. So this is a really important topic, but we haven't addressed it yet in genetics. So I did a big GWAS of fields of education, harmonizing data from MOBA, FinGen, and Dutch Lifelines. And in all three of these cohorts, we have linked register data, so we know exactly what someone's highest qualification is in, and we can harmonize it to the international system. And then we get new information from these results on connections between fields. So I think this is quite interesting because, you know, in this register data, most people are only observed in one field. So we can't really study what are the connections across different fields. But we can with genetic methods where you can estimate genetic overlap. So, for example, we see that there's a genetic correlation of 0.57 between arts and humanities and social sciences, journalism and information, but there's a 0 genetic correlation between social and natural sciences. I don't know if that suggests anything about the difficulties of collaborating across those boundaries, but so what I was really most interested in using that data for was to just get a map of the structure of sorting into educational fields. So when we have all these genetic correlations across different educational qualifications, we can reduce the dimensionality of that and look at what are the main kind of patterns there, what are the main patterns of sorting. And the first principal component seems to capture a difference between social and technical. So we see engineering is really far along the technical side, whereas education and social sciences are further along the social side. But it seems to be basically fields involving things versus people. And then the second axis seems to capture a difference between choosing something or completing a qualification, something that's more practical, like services or health or agriculture, versus something that's more abstract, involving conceptual thinking kind of thing, like social sciences, arts, and natural sciences. So then to kind of understand these a bit more, I looked at genetic correlations with 100 different things. So we don't really know the causal mechanisms underlying these correlations, but we can, it gives us some kind of hypotheses to go on. So with personality is an interesting kind of lens to look at this from, because personality differences emerge quite early in life and they're quite heritable and stable. And it looks like the social fields are more related to extroversion and agreeableness, which kind of makes sense. And the abstract fields are more related to openness to experience, which we know is related to curiosity and things. But then when we think about links with behavior as well, we see that people who are pursuing more social fields, they also, the genes associated with that also pop up in being more likely to visit your family and friends more. And then in terms of the abstract versus practical component, we see that people who are in these practical fields, those genes are correlated with relationship satisfaction. So that could be because of multiple different causal relationships there. But it could be, for example, that people with more kind of social interests, they end up choosing fields that lead to a job where they can spend more time with their family because it's more compatible with work-life balance, for example. But then, yeah, what I find most interesting in these genetic correlations is that even though we have actually controlled for educational attainment just to focus on genetic associations with the fields per se, we still see links with socioeconomic outcomes. So in particular, these more abstract fields are genetically correlated with greater occupational status, educational attainment, childhood IQ as well. But an interesting one, I think, is that it goes the other way for social and economic stability. So that could be capturing something to do with how these abstract fields usually lead to more elite professions, but there are actually potentially some downsides of those in terms of usually involving moving to a big city and being less connected to your family and friends. So yeah, this expands the scope of research on horizontal social stratification, I think, because we're looking across the phenome and understanding links with personality and behavior. So yeah, I think overall, these results are showing that we can use genetics to understand how the family environment works, how school inequalities are shaped, and potentially these ways of conducting genetic research could help us to provide answers on what can schools do to cater more to different types of children, or what are the barriers that need to be removed for outcomes of children with genetic risk for ADHD, for example. And then thirdly, we're also providing new evidence on large-scale patterns of social stratification that are linked to fields of study. And we could use these genetic results in the future to see, for example, how are children with tendencies towards different interests and subjects treated differently at school, and how did they experience school? How do these kind of educational specializations affect life outcomes? Because there's been a bit of a difficulty to study that in any causal framework previously, but we could use these GWAS results to do things like that. So yeah, that's just a summary of what I think are some interesting next steps, and maybe you could provide some ideas or comments on those. And another kind of caveat here is that we're looking at the Norwegian/Finnish educational systems, which are really unusual in a global kind of sense, because they've just provided high quality education from age 1 for free to everyone, basically, and that really affects the interpretation of all these results. So, for example, with the school inequalities thing, I think that makes those results even more striking, because that's a system where they have so many different policies and initiatives and culture to try to reduce differences between children. But we still see these inequalities. And then with respect to the fields research, that this context really affects that as well, because we just know that people have much greater ability to pursue their interests in a country like Norway, where you can go and study arts, and you get, you know, the same funding as somebody studying a different subject that's more typically like normatively valued. And there's also weaker links between what field you study and what kind of job you can do afterwards and what salary you get. So I'm really keen to discuss with you all how to do kind of research in Norway where we have all big data and methodological advantages, but how to make it more generalizable and relevant to educational systems more broadly. Thank you to all my co-authors, and yeah, it would be great to hear your feedback.
So much, Rosa. So if you don't mind, I'll step around you so I can see questions that are on here. But while I'm checking that, I'll open it up to the room if anybody has any questions or comments. Yes.
Choice of subject, at least in recent times, been quite gendered. And I was
Yeah.
wondering whether there's any if you look separately at it, and then wanted to see if you get different genetic effects.
Yeah, that's a really important point.
Is it good? Sorry, is it? I don't know. I've not been online before. Is it good if we repeat the question? Do you mind
Yeah,
repeating the
sure.
question here so that people can hear online and then answer
Yeah.
it?
So I was asked about the role of gender, and yeah, there's huge gender differences in Norway, even more than in other countries. There's greater gender segregation in the labour market, and we see in the data that the engineers are 87% male, for example, and the health and welfare category is mainly female too. But I tried to do various things to study that, like separating the the gender groups and repeating the analyses. But it's very tricky because even within the genetic correlation is not very high between men and women for engineering, for example. But that is mainly because within that category, men and women are doing different subjects. Like the engineering category also includes construction, and yeah. So I think there's a lot of challenges there with actually doing proper comparisons and figuring out what it means.
Yes, I presume you've got quite an empowering when you think about where it's.
Yeah. Yeah, but I think it's really important, and what I'm a bit scared of is that people will take these engineering GWAS and then make a PGI and say, oh, this is more predictive in boys, and interpret this as some kind of greater effects of engineering interests in boys or something, but it's just because of the sampling. So yeah, do you have any? I would love to hear ideas about how to tackle this kind of thing.
I suppose I'm thinking more in a British context. I don't know how Norway would change. It would be different, but I imagine you've also got change in terms of the sort of sex ratio in the discipline. You've got changes over relatively short timescales as well.
That's true. Yeah.
I don't know whether that's an additional useful property of the data, or it's just an additional complication, which makes it harder to get any results then.
No, but that sounds like a good potential way, and to look at the fields that have become more gender equal and focus on younger cohort or something.
I would imagine that if you did the PGI of engineering, for example, you wouldn't see a difference by sex. But that wouldn't be possible to see that.
Could you explain what you mean a bit more?
So you generate the scores for the PGI. Do you get GWAS hits, or is this how long do you?
Yeah, I just haven't. Yeah. I chose not to emphasize that because of all the social patterning of the data.
So it's the allele frequencies are going to be the same pretty much in males and females.
Yeah.
And so if you make a score of PGI for the males and the females, the weights are the same, the allele frequencies are the same, the distribution should be the same. Yeah,
that's true. So it is there isn't really a better way to study the gendered nature of it than.
I mean, one other, again, potentially complicating factor, potentially something that could be handled on something, is that have you checked whether there's a distinct kind of genetic signal for going into a field which is non-gender normative?
Yeah, that was one of the things I did as well, was to just focus on the fields that have more closer to 50-50 gender ratios. And yeah, and then I repeated the same analyses, looking at the structure of the fields and stuff, just with those. And that was quite useful, because then we saw the same technical versus social divide, even though we removed like engineering, for example. So that suggested that those kind of broad patterns aren't just due to gender socialization.
I guess.
But is that what you meant?
I meant maybe something slightly different, which is that, is there something shared between the women in engineering and the men in healthcare?
Yeah, because they're non-normative choices.
Yeah, if you're doing something surprising given your gender, that might not be random with respect to anything, including various genetic influences.
Yeah, one thing I noticed was that those non-normative categories, the heritability was higher, but which is a bit, I'm not sure you can really interpret if that means anything, but possibly could mean that there's greater role of individual differences and interests, like if you're going against normative barriers to make your choice.
So parental effects in this as well, presumably, because I imagine for a lot of people, what they see their parents doing is it's going to be that's their first thought of is
Yeah, I was really interested in that, so I repeated some of the analyses controlling for the parents' field of study, and I was a bit surprised because the SNP heritabilities were not attenuated very much, so that suggested that those parental fields didn't really have a strong kind of role there, and that's something I want to follow up a bit more.
That's brilliant, really interesting. We've done some work previously with gene environment interactions geographically. I thought it was really interesting, the different fields, maybe the fields that would lead people to move away from their original home location, lead to fewer family collections and lower satisfaction with social relationships. And presumably it'd be possible to do, there's the data in MOBIT to actually look at where people have moved and what they've moved away from their home location. That would be really interesting to do with the have you done that already?
No, I really want to. That's like just my pet hypothesis about what could explain the results, but glad to hear you're interested in that, because I really thought that could, like, urbanicity makes sense as a sort of confounder basically in this analysis.
It'd be brilliant to talk about it more.
Yeah, definitely. I'll make a note of it.
Any more questions? I'll just check if we've got anything online. Don't think so. Yeah.
What was this sort of thinking behind adjusting for educational attainment? I was just wondering if there's something you could do with educational attainment, if there's a misalignment of choice, does it change your educational attainment?
Yeah, that's a good idea. It's been a lot of back and forth about controlling for educational attainment, because there are obviously so many different causal relationships going on. Like I think usually your educational attainment is more likely to be a consequence of choosing to study something in particular, but it could also be that your kind of desire for having a long education and learning more leads going into something that lasts for ages. But yeah, that's a good hypothesis, that we could use the PGIs to look at some kind of match between people's genetic predisposition and what they choose, and whether that correlates with
Gareth, no time for one more. Yeah,
sorry. You did a really lovely variation part with respect to sort of like the random slope subject for the schools. Do they display geographical variation in where the schools are? If you were to map those slopes, is there patterning in those?
Yeah, in that analysis, I controlled for municipality and neighborhood and everything. So so those particular results are even more kind of causal to schools because you're basically randomizing the kids to families, to different areas, and it's just looking at differences between schools. But I think what you're saying is interesting. More like we should look at that per se as well. Like, is there something going on with the interplay between the area and the school rather than just controlling it away? If I understand you correctly.
Yeah, I think so.
Yeah.
I think, yeah, it's the idea that they're finding in usually in like educational literature would be like that's a sign of really egalitarian stuff. But then in the instance that one of the indicators is genetic, I'm not used to thinking like that. But yeah, that sort of implies the opposite.
I don't get what you mean there, I'm afraid.
I'll catch
We
up with
can
you.
talk about
afterwards,
it, yeah.
sorry.
Yeah, maybe we'll continue the conversation
yeah,
after. That's all right,
chat.
feel that. So yeah, thank you so much again, Rosa. And now over to Joakim, who's going to tell us about parental SES and young people's mental health. So over to you.
All right. Thank you. My name is Joakim. I'm doing a PhD currently in the middle of it at the University of Oslo. In this presentation, I'm going to present a couple of projects I've been working on, and then a couple of projects that I want to begin. So I'd mostly want feedback on the last stuff, because that's where I really think you can contribute, or I can gain the most for my PhD project. Bit about my background. I'm a clinical psychologist trained in Oslo, and I've worked in different jobs, among them MST. I don't know if any of you are familiar with it, but it's a type of therapy that addresses issues on many levels, like from communication in the home, school, and what they do and what the teachers do, other resources in the community. So I come from this association between socioeconomic status and children outcomes from clinical work, where for example, where a family lived in a 2-bedroom apartment and the parents were divorced, but they couldn't afford different places to live. So yeah, so a bit of a context from Norway, which is the population I'm studying. There has been an increase in diagnosis of mental health disorders the past 10-15 years. There has also been an increase in inequality. This is the Gini index for income and wealth, and across different ways of measuring this inequality, there is a rise for all these indices. Yeah, so like this isn't a new association. A lot of people have studied this, and we know that this relationship is so confounded by so many things. Like we've talked about school and geographic variables, and so it's very fraught with confounders. And for me, coming as a clinical psychologist, one of my first questions coming into this project was, what is socioeconomic status, and what contributes to the variation in the parents that I'm studying? And like when thinking about what it is, there's one literature review I read of psychological literature where SES had been defined 167 different ways or something. So it's just been not always clear what people mean. So one of the 3 questions I had coming into this is, how large are the genetic shared environmental and non-shared environmental factors associated with SES among these Norwegian parents? And I chose to focus on what some call the big four: educational attainment, occupational prestige, income, and wealth. And I've been using year-by-year registry data. And then the second question is, how much do genetic and environmental estimates to SES indicators vary across genotype and family-based methods? And this is just a little selection of different studies and their heritability estimates. And there is a wide range depending on the sample, depending on the cohort and what method is used. So in this study, I want to compare these indices using several methods within the same sample. So it's easier to compare both across indices and methods. The third question I had coming into this is, how much of the genetic and environmental contributions are shared across SES indicators? And this is genetic correlation. The lower triangle here is from a twin design, and the upper triangle there is from genomic studies. There's a bit of a difference there, and here we see there's a lot available because wealth hasn't really been included in a lot of these studies. Yeah, so yeah, it's currently under revision, this paper, but I'm gonna show you a couple of the results. The first result is the heritability estimates from these different, or maybe I should stand over there so people hear me. Across these different indicators, and here we see that occupational prestige and education have the highest heritability across methods. Yeah, and wealth isn't that far off income, even though it's they're quite not that highly correlated phenotypically, and yeah. And the second result I want to show you is how, when we do PCA on these different variances, the non-shared environmental variance between here from the IBD, which is between full siblings, is barely above what we would expect if they're uncorrelated. So a lot of the shared, the variance we capture when we do these PCs for SES indices are mostly coming from shared variation, which is genetic variation and shared environmental variation between siblings. So this is important for me if I want to study the impact on children, that if I use these SES indices, I miss a lot of what's above here, explaining variance, like outside of the heritability, what's explained by additive genetics and shared environmental variance. Yes, so coming back to this figure again, this relationship is what we often study. However, we might want to look at the other way too, that perhaps different children, the differences in children create differences in their parents' socioeconomic status. And we're doing this in a Norwegian context, looking at how genetic effects of children affect the parental finances. Here we control for the parents, so whatever effects the children have are from like Mendelian randomization in a way, or like, yeah. So one of the outcomes we're looking at is mother's income from work. And here we see, this is an event study plot. We see how having a child that really affects the income from mothers, and we want to look at what part of this variance is explained by the children's genetics, and we did a trio GCTA that doesn't really which is a bit of a black box. Theoretically, we don't quite know what is affecting the mother's phenotype, but this is some preliminary results. But here we see, at least at year 1, we have a significant effect from the child, about 4%. Well, yeah, on the mother's income. Yes. Yeah, so back to this question, which is what I'm trying to tackle in the last part of my PhD. And I want to focus on the financial aspect. Yes, how do parent finances affect young people's mental health? And I want to include wealth here as well, which when reading the literature, it hasn't been included nearly as much as income. And here we see that in this cohort of Norwegian parents, there's phenotypic correlation of about 37%. And when we look at the non-shared environmental correlations, they're practically not there. So which means that a lot of what's shared between the variation in wealth and income comes from family shared variation, such as genetic and shared environmental variation, which I think we should also include what has affected parents in their unique environment, which accounts for a lot of the variation. The data we're using is from Statistics Norway and the Directorate of Health. So it's year-by-year registry data, and we might do some validation stuff in MOBA, but mostly using registry data. One of the first things I want to do is just do some descriptives, like Singa and colleagues did of income percentiles in Norway. So show these different distributions also across age. I was thinking doing it up to age 30 because we know, it seems like it affects young people into young adulthood as well. So I want to capture that as well. Yeah, this is a bit grainy, but you get the idea of these descriptives. And here are some other questions I really want to try to answer. The first is changes over time. As we saw, these inequalities have grown in Norway, and we know that income has had an increased effect on their children. Parent income has increased effect on children's GPA. So I'm wondering if this is also the case for mental health outcomes. Another question is this intergenerationality, which I don't think is a word, but I like it. Which is, to what degree can we trace associations back to like the grandparent generation and to the parent generation of the effects on mental health? And a third question I find interesting is what plays a bigger role of income and wealth when we model them together. Next, I'm going to show just a suggestion of how I've been thinking about modeling this using logistic regression on prevalent. And the first line here is I want to include both like maternal income and paternal income. income and maternal wealth and paternal wealth to see the relative effects, and then here try to capture the grandparent effects in a way through the siblings of the parents. We don't have data on parents. We have only data from 1993. It's not only, but it's to capture this effect, we're thinking about using some sort of sibling average or something. Next, have some sort of familial risk score with because we know if the parents have had some sort of mental health diagnosis after the year of, I think, 2006 or something. So we could include that. And then an interaction term where we see has this changed over the years. Other things I really find interesting is I think I talked a bit with Gareth about this on her email, is the relative versus absolute SES, which I seem to observe clinically that sometimes the issue was that the kids were in a environment where they were very far off what the other kids were, and other times they were in an environment where everything was a bit missing in a way, like the school had too many kids to help. There were just a lot of issues in the area. So I'm just, it would be interesting to disentangle those mechanisms. And also income trajectory, I just find a bit of an interesting perspective, like if the wages of the parents are going down, does that affect this in some way? I don't know. I would love to hear your thoughts. The last project I want to present is I want to look a bit at the climate around the past few years. We've witnessed COVID and inflation. So I'm also interested to see how this affects different groups. So looking at across the population, whether inflation is associated with mental illness, and seeing whether some groups are more at risk than others in these type of economic climates. Also, if there are different consumer goods that have stronger associations, and if there are any temporal effects, like there's a lag there. Yeah, so this has been how I've been thinking about looking at it through with like a DAG. And this is kind of like the main plot I was visualizing, where we can use this sort of interaction term to see if who inflation affects the most. Yeah, I have many questions. So as Rosa and Robin said, we're going to be here for a month, and I'm very interested in hearing your perspectives. And I want to speak to you guys when I do this research. So amongst others, so I'm really interested in hearing what you're curious about when I presented this. I also am struggling to assess like what degree of causality interpretation should I aim for in these studies. Yeah, and with inflation, should I use some geographical covariance? I don't know. Yeah, that was pretty much it. Yeah.
very much, Joakim. I'm going to awkwardly climb behind you again and get to the questions online. If anyone online does have any questions, then just pop them in the chat. And in the meantime, I'll open it up to the room for any questions or comments.
I think it's really cool. I went to the, to the model that you showed, which is looking at the split regression for mental health outcomes based on parental well.
Yeah.
There's a bit of literature about there being like an effect of poverty on outcomes, which sort of tapers off until you reach a threshold, and that so like being wealthy doesn't have a big effect, but being poor has.
Yeah.
So there's like sort of a nonlinear threshold.
Yeah, I was thinking about having like a fixed effect for the lowest quantiles or deciles. I don't know. I haven't, but that's a good point. I think that's a very good point. I'm just gonna write that down. Yeah.
I was thinking about the first, thank you, it was like fascinating. About this separation of the big four. Also thinking about parental effects.
Yeah.
I don't know if it's something, I'm sure you thought of this, that like wealth in particular is going to be quite correlated with stuff to do with grandparents.
Yeah.
And I don't know how, I don't know how that could be got around, or maybe you wouldn't want to get around it. Maybe that's.
I think that's, I don't, yeah, I think that's fine. I don't have any, and that's where it's hooked up in a way. But, yeah. I find that interesting in itself. Yeah.
Yeah, I just think I'm wondering how the age of the parents when the child is born could play into this. I was thinking about your big four. Presumably the financial ones continue to increase as the parents get older, and
I should definitely have that as a covariance. Yeah,
but because you've got so you've got changing. I know there'll be some studies of parental age and mental health in children.
I'm sure.
Obviously genetics stay the same. I can't quite work out how it would.
No, but that's
maybe it's whether the presumably education or education related variance, or maybe wealth related variance, and parents might relate to when they become.
Yeah. No, that's definitely worth controlling for and having and including. Or maybe a question itself.
I'm not quite sure what role it would play.
Sorry, one more thing. I noticed on a relatively early slide when you had that graph of income of the mothers and fathers, and on the x-axis it was like time to or from when the kid was born.
Yeah.
So I don't. Let me just see that again. So the blue bars are the mum, right?
Yeah.
And before the kid's born, they're a lot higher than the dads.
Yes. So, this one. I zoomed a bit past it. We don't quite know. We're still working on the model. I don't think we've controlled for enough stuff here.
No, I just meant on the graph on the left.
Oh, this?
Yeah. So is it that, if you compare people without kids, do women in Norway earn more? Or is that some weird selection thing about the dads in Norway specifically?
It's relative to the time of birth, isn't it?
Yeah.
Is that right?
Yeah.
Or
Yeah. So what we've done is we've had one dummy variable for each year, and then regressed it on the phenotype. So this is here we see that what year compared to the birth has an effect on the mother's So these are just mothers and fathers.
Yeah.
Does that make sense? Or am I just?
What,
So it's a coefficient, not actual.
okay, that makes
Yeah.
a lot more sense.
Okay.
Yeah, I was
Okay,
wondering,
sorry. Yeah.
adding more.
No, no, it's yeah, no, it's not, they're not earning more. It's just the effect of
Okay, thank you. That makes a lot
compared to the birth year. Okay, sorry, I didn't explain that well enough. Zoom in through.
But also Norway presumably has very good maternity pays and what.
Yeah.
So much.
That's a good question. And why does what kind of child you have matter too? Like we in the no, I mean like why does children, the genetics of children have an effect on year 1, 2? Like in a society where everything is compensated for, we wouldn't see these effects. So I think it's a great question, and that's part of what we want to get at.
Because I heard Norway has this interesting policy where you can work for women can work 80 or 90% for the first 10 years.
Yeah.
So I don't know how much that's impacting.
I don't know either. That's
Only for women. I thought it was only for women, but I could be wrong. I'm not up on all.
yeah. I wish I could. Yeah, we still have to look more into what might be the explanations there.
Yeah.
Really interesting talk again. Thank you. I know that Claire Howard, who couldn't be here today because she's teaching, will be really interested in talking to you about like moments of change like this and genetic and effects on well-being.
All right. What's her name?
Claire CLAIRE Howard HAWORTH.
All right. Thanks.
Any other comments, questions?
Yeah.
It's gonna be smarter.
No.
This one was really confusing before. I was gonna say, so when you were talking at the end, I think it's really interesting when you're thinking about how you frame wealth in a causal framework, because it's very, very hard to imagine an intervention on wealth which isn't just income, right? They're like if you were to intervene on wealth, you'd give.
Inheritance tax.
Inheritance tax was removed in Norway in 2014. So that
Isn't there a wealth tax?
no, there's no inheritance tax.
Well,
There's a wealth tax that has newly been implemented.
Okay.
So those are.
Yeah, okay.
Is the inheritance tax policy change useful as the working discontinuity?
It is. And yeah.
Was it rolled out universally? As in, did everyone get the inheritance tax removal at the same time?
Yeah. And there's also this.
That's the UK.
That's a good point. We could use that as an intervention. Okay.
But if the problem,
But that
I
would
imagine is the problem is at the much lower end.
yeah.
You know, it's about relative wealth, so
Yeah.
removing inheritance tax is probably not going to affect the right people.
No, and when we look, there's I think Sandra Black and some colleagues newly published a paper on what wealth in Norway consists of in a certain cohort, and there's a great graph in it, which and income is like a substantial part, except for like the top 1%, where it's risk investments and stuff like that.
Okay, we're at 1:30. Thank you both. If you do join me in thanking Rosa and Joakim again.
Thank you so much.
I think that's set up some conversations really nicely for your month in Bristol as well. So yeah, make sure to pop by the office on the corner over the next month. Lovely to see you all. Hopefully see you soon. Thank you.
Thank you.